Okay, so today we're going to talk about bacterial diseases of the eye, and let's get started. So, how do we get these? Usually, bacterial diseases of the eye, they usually start on the skin or in the upper respiratory tract. So in other words, what's going to happen is you're going to touch somewhere on your skin or your nose, and you are going to get bacteria onto your fingers. And then you're going to rub your eyes, and when you do, you are going to get an eye infection, a bacterial eye infection. So this is how we get this. And the bacterial diseases that we're going to cover, and there's more than this. Let me remember, DZ means diseases. All right. So the ones that we are going to cover is ophthalma, neonatorum, okay, that's one. We're going to cover chlamydia, which a lot of people always think of chlamydia as being a sexually transmitted disease. As you've already seen, we covered chlamydia pneumonia, which is something that, which is a pneumonia that can lead to atherosclerosis when we're doing the respiratory system. And now you can see we have chlamydia conjunctivitis. And then the last one we're going to cover is trachoma. There's more than these, but these are the ones that we are going to cover in this class. So let's get started with ophthalmia neonatorum. Okay, so this is a serious form of conjunctivitis. And so if you've seen the video on conjunctivitis, you'll see that conjunctivitis can be caused by many different things. And conjunctivitis can also be harmless. If you don't get enough sleep, you can actually get conjunctivitis. If you rub your eyes, you can get conjunctivitis. Allergies cause conjunctivitis. So it's redness of the eyes. The bad thing is this is caused by Neisseria gonorrhea. If you remember at the beginning of the year, we covered Neisseria when we were talking about meningitis. And so this is gonorrhea, EAE, okay? That's the bacterial name. It's just more commonly known as gonorrhea, not gonorrhea. Okay, infants get this as they pass through the birth canal. So what happens is the mother has gonorrhea, and obviously she doesn't know it. And so it's in the vaginal area, and as the baby comes through, it gets in the baby's eyes, and then they end up getting this. And this can actually lead to blindness. So women can get this as they give birth. It's not common to get it. Actually, it might be kind of common to get it because gonorrhea is a pretty common condition, but it's not common to get blindness, but it causes a high rate of blindness, and I'll explain this in a minute. It causes a high rate of blindness. Obviously, it's going to be in infants because of the fact that they're the ones coming through the birth canal. Large amounts of pus can form right in the eyes. So the problem is if it isn't treated, what's going to happen is you're going to get ulcers on your cornea. The cornea is the clear part that's above your pupil, not your pupil, the colored part of your eye and your pupil, the iris and the pupil. Treated, it can cause ulcers, and so the function of the cornea, it can cause ulcers, is to direct light into the pupil. So if I have ulcers on the pupil, on the cornea, if I have ulcers on the cornea, I cannot direct light into the pupil properly. Ulcers on the cornea. And the bad thing is the cornea doesn't have a very good blood supply, so it's hard to get this to heal. This should be an E right here. If you notice, I always make my E kind of funky just because I need to make it large so it looks like an E. Okay, so what happens is when infants are born, they used to give them silver nitrate, but now they just give them antibiotics, and that will help prevent this. This is why I was saying it's not that uncommon, or it's not that common to get blindness in infants, but at the same time, it is common to get if you don't treat it. The thing is, when babies are born today, they put antibiotics in the eyes. Today, infants are given antibiotics when they're born. You got this. Eye drops. That contain antibiotics to prevent this. Okay, so they contain antibiotics to prevent this. And that's ophthalmia neonatorum.